For our most regressed exercise from our original plank is going to be the kneeling elevated plank. So we have our bench here, which we had to get kind of creative to make. That's okay. And we have our lovely client, Kim, who is going to be demonstrating for us today. So when you're in this position, we're going to have them put their elbows up on the bench. They're going to hold their hands. We want to make sure that their elbows are underneath their shoulders. We want their scapulas to be retracted. We want to make sure that their core is nice and braced, but we want to make sure that they're still breathing through this exercise. So we're then going to get a client to have their knees on the ground, bend their knees up to about 90 degrees, have their ankles crossed, and we want to make sure that they're not popping their butt out. So we want to make sure that they're dropping the butt down, and we create that nice line there. Perfect. That is a wonderful plank by my mother, Kim. You can relax. So by elevating the client's body up onto this bench, we're relieving some of the body weight that is going to be being put through the abs. By having them on their knees, we're shortening that lever, so it's going to be a little bit easier, going to have a little bit less force going through the abs. Putting those two things combined, it's going to decrease the total load, and it's what's going to make this exercise that much easier than just the normal plank or our next regression that we're going to do after this. This exercise can be used in the proliferation phase. Kind of later, we want them doing some more basic stuff first, but an exercise like this could be used if a client has any sort of injury, maybe a strain to the rectus abdominis. Okay, for our first regression from our baseline exercise, which is the plank, we are going to be doing an elevated plank. So just as our most regressed exercise, it's a lot of the same cues. We're going to get Kim here to get into the position. So she's going to be on this elevated surface again. She's going to have her elbows down, and she's going to have her elbows kind of just under her shoulders. Scapulas are going to be retracted. And she's going to extend her legs out, which is different than last time we had them bent up. So we're going to make sure, same cues, retract those scapulas, brace that core, butt down just a smidgen. There you go. And then she's going to have this nice long straight leg, and she's going to be straight from head all the way to her toes. Okay, so you may relax. This is some magic editing. So by extending the legs here, we are lengthening the lever, which is going to be putting more pressure through the abs, which is going to make this exercise a little bit harder than our last regression. This exercise would be used in the proliferation phase, kind of a little later than our first exercise. And it could be used for things like low back pain, because it's going to stabilize, work on those muscles all on the front of the body, which is going to help to stabilize that low back. For our baseline exercise here, we are going to have the plank. We're going to be doing it on our elbows today. Bless you. And again, it's going to be very similar cues to our regressions as well. So we want to make sure that their elbows are in line with their shoulders, and we want to make sure that their scapulas are nice and retracted and depressed. We want that core braced, so they're flexing those abs nice and strong. We make sure that their butt is down and not popping out at all, and that their legs are straight, and that they are breathing through this exercise, because it can get rather difficult after a little bit. So we're going to get my mother here to show us her lovely plank. So down on her elbows, we're going to have her elbows in line with her shoulders. She's going to retract these scapulas. Perfect. Core braced, butt down, and we have that nice line from head to feet that we are looking for. So she's going to hold this for a little bit just because I am mean. Okay, you may relax.
I'm breathing.
You're breathing? Good. So by taking the elevated surface away, we are putting more weight into their arms, which means that they'll be using more of their abs to support the additional load that is being put through their body. This could be used in the proliferation phase, but it could also be used kind of in the beginning of like the maturation phase, depending on the injury. And the plank is good for a ton of things. One injury that it could help with is if somebody has excessive lumbar lordosis. If we're getting those abs activated, it's gonna pull that core down and stabilize the back. Since we're also on our elbows and we're making sure we're retracting those scapulas, this could be used for any sort of rhomboid strain, just to be working on getting those scapulas in place. Pat you on the head again. Okay. For our first progression of our plank here, we are going to do what's called a long lever plank. This is going to be a very similar position that we were in last time. So a lot of the cues are going to be the same. We want to make sure those scapulas are retracted and shoulders are down. We want to make sure that their core is nice and braced so that their back isn't going to be bending out. We want to make sure that butt is down in line with shoulders. And we want to make sure they're a nice line from head to feet. So the only difference with this one is that instead of their arms being underneath their shoulders, we're going to have their arms extended out above their head. So we want their arms to be in line with their shoulders or just a little bit out. Our lovely assistant Kim here is going to show us this position. There we go. So we're going to have the arms extended a little bit farther above the head, in line, maybe just a little outside. So yeah, shoulders, butt down. We want to make that nice clean line from head to feet. Okay, you may relax. So there's a few reasons why this is going to be a little more difficult than the original plank. Because we have the arms extended above the head, it's going to lengthen the lever just a little bit, which is going to put more force through the abs, which means they're going to have to work a little bit harder. It's also going to lengthen the abs a little bit, which is going to make it a little bit more difficult to contract them. And it's also going to limit the client's ability to create stability using their arms. So we're taking that away by putting them in the unsteady overhead position, which means that the abs are going to have to work a little harder to be able to maintain that straight back and flat butt. So this exercise is going to be used in the maturation phase. And it can be good for things such as shoulder injuries that involve maybe the rotator cuffs, the traps, the rhomboids, or the serratus anterior, just because we're in that overhead position where it's not as stable and the shoulder muscles are just doing that little bit more work. For our next progression of the plank, we are going to be doing a alternating single leg long lever plank. So we're going to be in a similar position as our last progression, except with this one, we're going to have them in the same overhead position. And our lovely client here is going to be alternating, picking up their legs. Okay, so it's going to be similar position as the last one. The arms are going to be above the head in line with the shoulders. We're going to have the client retract their scapulas back, have them brace their core, make sure their glutes are firing and activated to keep those hips up. And then we basically just want the body to be in a nice line from head to toe. So we're going to get our lovely client here to get into position. And once they're in that long lever position, perfect, what we're going to get them to do, brace that core, retract those scapulas, perfect, and then she's going to pick up one leg, nice, and then the other. Okay, so she's not really in that long lever position. We're going to get her to extend her arms out a little more to make that just a little bit harder in the same movement. So we want to make sure that the hips aren't rotating here. Nice, so we want a nice steady base. So you can stop that there, nicely done. So with this exercise, there are a couple of things that are going to make it more difficult than that last progression. So the long lever position is already pretty hard, but by making the client here lift their legs up, it's making their base more unstable. This means that they're going to have to recruit more muscles in the area, and it's also going to work those external obliques as well. Also, because we're extending those legs up, we're going to be working those abdomen muscles at different ranges of motion, which will make this exercise just that little bit harder. This exercise would be used probably in the late stages of the maturation phase, just because we have a dynamic component to it. And it could be used for injuries such as internal or external obliques. So since those muscles are being used as we're trying to stop that rotation of the pelvis and the abdomen. Or the abdominal